Welcome to Let's Talk Micro. Hello, everyone. Welcome to another episode of Let's Talk Micro. I hope you had a great week and thank you for listening to last week's episode. I hope you enjoyed it. Last week we talked about PYR and strep typing. But before we get started, remember that you can listen to Let's Talk Micro on Apple Podcasts, Spotify, Amazon Music, Pandora, Stitcher, Audible, TuneIn, Google Podcasts. So whatever you listen to your podcast at, you can find Let's Talk Micro. I am also on Instagram as Let's Talk Micro and on Twitter as Let's Talk Micro 1. So please go ahead and follow. So last week, it was a great episode. Like I said, we talked about PYR and strep typing. So by now, we have gone over catalase, coagulase, PYR, and strep typing. So you first start with catalase, right? If it's positive, you do coagulase. And we're talking about gram-positive cocci. And then if it's catalase negative, you do a PYR, right? There are several methods out there, but overall, either like with the carton one or the one with the disc, it involves applying your colonies, basically waiting 2 minutes, and then adding a developer. And then out of the strep species, you should have two positives, right? Do you remember? So you had Streptococcus pyogenes and Enterococcus. They're supposed to be PYR positive. Then you can also use PYR. Remember when I mentioned on the episode about the 40x objective? You do a quick wet mount. If you want to see if you have alpha colonies, if you're on the urine bench, you have an elderly patient, you want to rule out Enterococcus urinae. So you have that's gram-positive cocci clusters. So it can be challenging at times. You can do a wet bound. Sometimes, you can see them well. And then you do a PYR. If your PYR is negative, we have Enterococcus urinae. And then if your PYR is positive, we have Enterococcus viridans, which is like normal flora. But in that particular patient population, elderly patients, if we have an alpha colonies, gram-positive cocci clusters, we want to rule out Enterococcus urinae, and it's PYR negative. So as far as the gram-positive cocci chains, you have your Streptococcus pyogenes and your Enterococcus. Remembering that Streptococcus pyogenes is beta hemolytic, and then Enterococcus can actually have all three. Another thing, remember when you're doing your PYR test, try to sometimes, inoculate multiple areas. That way, if you have a questionable reaction, you're not sure if it's positive or not, you can see your positive, or you can see your pink color, which is what a positive is. You can see that pink color in multiple areas. So keep it all, you students out there, you new techs, keep that in mind. It's very helpful. So, and then Enterococcus, yes, you can have all three hemolysis, alpha, beta, and gamma. But the most common ones are gamma and alpha. So we also talked about your strep typing, right? It is based on the Lancefield system. So, they have a carbohydrate on their cell wall. So then that typing method, we have a latex that corresponds to that antigen, to that carbohydrate, and then it's classified in a system. So we have A, B, C, F, and G. A is Streptococcus pyogenes. B, Streptococcus agalactiae. C, you can have Streptococcus dysgalactiae or anginosus. F, Streptococcus anginosus. And G, Streptococcus dysgalactiae or anginosus. It's for more details about how you do the typing, just go ahead and, if you haven't tuned into the previous episode, go ahead and do so. But the one thing to remember is that for this test, you need to have beta hemolytic strep. Like I mentioned, if you look at the flowchart that I posted on Instagram, Streptococcus aeruginosus can actually have all three hemolysis, all three kinds, but you only type it when it is beta hemolytic. So just remember that. Also with Streptococcus aeruginosus, you should never smell plates, but it gives a butterscotch smell. Just saying. So that's basically, for your strep typing, and then you keep that in hand with the PYR testing, right? Because if you have beta hemolytic strep and you have a PYR positive, then you go ahead and type for A, do the typing for A. If you have a PYR negative, then you do C, F, and G. And like I mentioned before, Streptococcus B, it has a very distinctive morphology. So for that one, you can still type it, but if you have a PYR negative beta strep, you can start with C, F, and G, and then maybe try B. But that's, strep typing for you. So by now we have covered 4 major tests that aid in IDing gram-positive cocci. So that brings us to today's episode. So we are still in gram-positive cocci, and real quick before we continue touching on those, then catalase, we can also use it for gram-positive rods. And for the positives and negatives, go ahead and tune in to episode 7. So now, as part of the flowchart, depending on which direction you go, right? So let's say you did your PYR, it was negative, you had beta hemolysis, you did your typing, and then based on that, you had your species. So what if it's alpha? What if it's gamma, right? So on the flowchart that I posted on Instagram, if you have alpha, you can maybe have Streptococcus pneumoniae. And as you microbiologists know out there, Streptococcus pneumoniae, or strep pneumo, as people in the lab say it, it causes meningitis, it causes pneumonia. It can also cause sinusitis and otitis media. So it is definitely serious. However, Streptococcus pneumoniae, it tends to have a pretty distinctive morphology. And besides being alpha hemolytic, it tends to be mucoid. So that helps in that visual. So it brings us to Optochin, which is not a biochemical, it's an antibiotic, it's a disc. And normally when you see, depending on the protocol of the lab, I've seen some places that when you have a positive blood culture, and on your gram stain you see gram-positive cocci in chains, you go ahead and add the P disc, which is the Optochin disc, on the first quadrant, to make sure that in case you have strep pneumo, you can rule it out. So I think some places that maybe if you see gram-positive cocci in pairs, which is more typical of strep pneumo, then you add the disc. So what is Optochin? So Optochin interferes with the production of ATP, adenosine triphosphate, in microorganisms. So like I mentioned, you put the disc on the plate, and then if the organism is susceptible to it, its growth will be inhibited. And this is seen by clearing around the disc. And then you measure that, with a caliper. You can use a ruler, and you measure the zone, that clearing from end to end in millimeters. So basically, if it grows all the way to the disc, it's 6 millimeters, because that's the width of the disc, of the P disc. So when you measure that zone of inhibition, 40 millimeters or greater, it's considered susceptible. And out of all the streps, strep pneumo is the one that's susceptible to Optochin. So this zone of 40 millimeters or greater, like I said, it's called susceptible. So this can actually be used as a presumptive ID for Streptococcus pneumoniae. And there will be an episode on presumptive IDs. So basically, with this evidence, like if you document that your pedis is susceptible, that's enough to call it Streptococcus pneumoniae. I mean, you can also check the protocols of your hospital. Some might require you to perform another method of ID just to confirm it. Nowadays, in the Molotov age, it's so much easier. You can get an ID so quick. So it'll be, it's good practice. Also, you have to keep in mind with the Optochin disc, a lot of times, maybe techs take them out at the beginning of their shift, and then they forget, so they leave them out. So a lot of times they don't work properly, and I've seen this a lot. Blood culture, the ID ends up being Streptococcus pneumoniae, but you have like a zone of 13 millimeters. So in this case, you do have to perform an actual ID, like Vitek or whatever system you use in your lab. But it's very typical. You're like, okay, it looks like strep pneumo. It is, but you still have to prove it, right? But then your Optochin is coming in at 13 millimeters. So just to recap, Optochin, interferes with the production of ATP, and then the organisms that are susceptible to it, their growth is inhibited, and this creates that clearing around the disc. And then you measure that clearing. And then a number of 14 or greater millimeters is considered susceptible. But remember, if you have anything less than that, you have to perform an ID by another method, depending on what your lab has, Vitek, Molotov. But yeah, and you text out there, just remember, only take your PDisc out when you're going to use it. Don't leave it out. It can cause this kind of problems, which at the same time, create more work. Because if you don't get that expected result, then you have to continue working and you waste supplies and you waste time. So, I mean, of course, in the lab, the patients always come first. That's why we do this. And then at the same time, we want to be conscious about our time, about our supplies, our time especially, because the time that we spend, doing all these extra steps, it is time that we could, spend helping another patient. So it is good practice to always be conscious about, time and supplies. So now that we went over the Optochin, now we have another test that we're bringing in. And this is the Microdase disc. So now this is not part of the flowchart, but this aids in identifying Micrococcus species. Do you know what Micrococcus is? So this is another species of gram-positive cocci in clusters. And they're typically considered a contaminant. So why am I mentioning it now after having, talked about strep? Well, you kind of tend to see more Micrococcus in the blood culture bench. So normally, all the other organisms, especially, Enterococcus and your streps, your staph, you see them everywhere from urine, wound cultures, respiratory cultures. However, with blood cultures, a lot of times you tend to have one organism, and then Micrococcus is seen more in blood cultures. Just remember, like I mentioned before, our body's full of bacteria, right? And a lot of it's good because it keeps the bad ones from taking over. So they're just, they help us. Like I mentioned before, with like in the genital area, lack of good flora can lead to like yeast and other organisms to take over. So the same is true in the body, that you have opportunistic organisms that when they find the space, they take over. So we have to be careful when we're looking at blood cultures, right? Because we were trying to rule out septicemia, and if the patient is actually septic or has bacteremia, we want to make sure that we catch that organism, and then we have to make sure that it is a pathogen versus contamination. So I'm just going to touch briefly with the blood cultures before I move on. So blood cultures, they get collected in multiple sets, right? So a lot of times, some of the organisms that are actually flora, they can cause infections, given the right conditions or the source. So a lot of times, like we kind of want to see if we have that same organism. So by having multiple sets, better said, we can see if we have an organism that's potentially causing an infection versus a contaminant. Like let's say that you have 3 sets of blood cultures, and all three are growing staph epidermidis, staph epi. So in that case, more than likely it is causing an infection. But let's say that you have 3 sets, and then one has staph epi, and then the other one maybe has like a virulent strep. So in that case, it's probably a contamination, that the area wasn't cleaned properly before collection, and some of that skin flora got in there. So Micrococcus tends to be, it tends to be normal flora. So normally when we see it in the blood cultures, we don't do susceptibilities for it, and they rarely, maybe you get it in one set. I mean, if you get it in multiple sets, maybe the physician might ask for some susceptibilities. But it is a common organism that's seen in blood cultures when it's a contaminant. So this disc, with this disc you can use it to presumptively ID Micrococcus. So this test is used for the detection of the enzyme oxidase. The enzyme, I'm getting technical, it reacts with the oxidase reagent and cytochrome C to form the color compound endophenol, producing a blue-purple color. Very simple test. Now you place your disc on a slide, you add the colony, and then you observe for a color reaction. So a blue color reaction, a blue color is considered a positive result. And then no color change is considered a negative. You also have to keep in mind that before you use this test, you have to make sure that you have a gram-positive cocci in clusters, so you don't get a false reaction. So by now we have covered 3 types of gram-positive cocci in clusters, right? Staph, Micrococcus, and Aerococcus. And you can actually also see Aerococcus on blood cultures. Maybe not as common as your Micrococcus, and definitely not your staph, but you can see them. So with this disc, it's very simple. This way you don't have to perform an ID on the Micrococcus. You can call it Micrococcus species when you have a positive result. And it's a typical presentation. You might have 2 sets, 3 sets, and then one of them grows Micrococcus. They're yellow colonies. They're slow growers. After 24 or 48 hours is when you see like the nice large colonies. But typically before you get to that point when you're reading it on the blood bench at 24 hours, the morphology matches the gram stain, gram-positive cocci clusters. And then you go ahead and perform this test, this disc, and you get a positive result, and you can call it Micrococcus species. And then just move on. And it's also a very typical presentation when you're on the blood bench. You know, a lot of times, most places, I mean, depending on how large they are, nowadays, when you have a blood culture and it's positive, you go ahead and put it on you perform an ID from that blood using like a nucleic acid method, a PCR method. And normally, some of these tests, I know definitely like on the Luminex does not identify Micrococcus. So you have a presentation where you have a gram stain that's gram-positive cocci clusters, and then your Luminex comes back as not, unidentified. And then when you look at your bench, then it's Micrococcus. So when you have a gram-positive cocci clusters that your PCR nucleic acid method does not ID, more than likely you have Micrococcus. And then to a lesser extent, you can have Enterococcus as well. But yes. And then we typically don't perform susceptibilities on it. And like I mentioned it. And on the other ones that are contaminants, we perform susceptibilities if they're growing on multiple sets. And this is true for coagulase negative staph and strep species. All the other ones like Corynebacterium, Lactobacillus, Bacillus, those tend to be performed upon request. So today we have covered 2 more tests, right? So after right now we have 6. And with this, we actually conclude the gram-positive cocci. Of course, there are more tests. You students out there, when you're going through your class, reading your books, there's like a bile solubility and there's other tests. But these are the basic ones that if you know how to do these, you will basically have almost no trouble identifying gram-positive cocci. Keeping in mind that depending on some things that you still have to perform like formal IDs, as in like Vitek, Molditov. So you have to correlate with the source. Like if you have if you have white colonies on a younger female on the urine bench, you have to perform an ID to rule out Staph saprophyticus. When you're doing the typing on your beta strep, if you have like CF or G, you still have to do a formal ID, especially for C and G, so you can differentiate between dysgalactiae and anginosus. For your Enterococcus, when you have Enterococcus, you still have to do an ID to see if you have Fecalis, Faecium. And when you have your alphas and your gamma streps that are PYR negative, you still need to do an ID to make sure you rule out Streptococcus anginosus, because that's pathogenic, versus Streptococcus viridans, which tends to be normal flora. So keep that in mind. So, but with this test I have covered, you basically have no trouble, IDing staph versus strep. So today we cover Optochin, which you use for Streptococcus pneumoniae, and then we cover the Microdase disc, which you use it for Micrococcus species. And with this, we wrap the gram-positive cocci, and then we move on to the gram-negative rods, which have different biochemicals. And that, my dear audience, is the end of this episode. We got through another one, huh? I hope you enjoy listening about Optochin and Microdase disc and listening about all these tests that we can use to identify gram-positive cocci in clinical micro. These tests, they're very helpful. A lot of times nowadays with the technology, such as like the MALDI-TOF, a lot of these new generations of techs, they're foregoing them and just going straight to the MALDI-TOF. There are such helpful tools in the lab. As always, continue doing your best. The patients will benefit from this, and that's what we are here for. Continue bringing that passion and continue talking micro. I hope you have a great week. Until next time.